This morning on BRN, maximizing your health span. Joining me now to help break it all down is Dr. Sandy Charles of the American Heart Association. Dr. Charles, so great to meet you. Thanks for joining us on the program this morning.
Thank you so much for having me, Jeffrey. A pleasure to be here.
And I love that you're wearing red in honor of probably one of our more important organs, the heart.
You got it. It's an honor to be part of the American Heart Association and to, quite frankly, devote my life to heart disease, being a cardiologist. It's the number one cause of death for Americans, and 80% of heart disease is preventable. So a big part of what I do is sharing the word on how we can all reduce our risk of heart disease.
Yeah, absolutely. And that's our topic today. I want to ask you first, if we could just back up. There's a term that's being used called health span. And I'm familiar with the term lifespan, which is the time that you're going to live until you're not going to live. But what, doctor, is the health span?
Thank you so much for bringing that up. We all know of lifespan, which is the number of years that we have being alive. But what's really important, and arguably more important, is our health span. How many of those years are going to be active years that are free of chronic diseases, that we can be independent and living our lives enjoyably? Unfortunately, currently, health span in America is at least a decade less than our lifespan. And so that's something that we need to work on improving. Almost 80% of people age 60 and older have 2 or more chronic diseases. And when it comes to young Americans, that number is about 50% of Americans, younger Americans, have 1 or more chronic diseases. So there's a lot of room for improvement because those chronic diseases affect our lifespan and our health span, and also increase our risk for heart disease.
Let's talk about some of those chronic diseases. You mentioned them. What are they? Just so we all kind of get it on the table. What are we talking about in terms of the chronic diseases? Is it heart disease or some other ailment?
Right. So heart disease for sure. And there are a lot of chronic illnesses that contribute to heart disease. And these are a lot of diseases that some of us may not know if we have them, if we're not getting checked and screened for them. So this is also plugged for everyone to go in for routine screening, even though you're feeling well. So a lot of the top chronic illnesses are high blood pressure, also called hypertension. That's the force of blood as it's pushing through our bodies and our organs, and it causes accelerated wear and tear of things like our kidneys, things like our heart, increasing dementia, increasing the risk of stroke. And there are a lot of things that we can do to help prevent that. Diabetes, high blood sugar. A lot of people don't feel when we're borderline diabetic or becoming diabetic, but this is also something that causes a lot of wear and tear to our organs, exponentially increasing the risk of heart attacks and other things. And then things like high cholesterol and increased weight, and things of that sort. All of those increase the risk of heart disease and chronic illnesses.
And you obviously you mentioned the American Heart Association, AHA. They've been doing work for decades and decades. One of the newer initiatives is Life's Essential 8. What is Life's Essential 8?
Yes. So Life's Essential 8 was published in 2022 by the American Heart Association, and it's a very important checklist of 8 items that have been research proven to help improve our lifespan and our health span, and to also significantly reduce our risk of getting chronic illnesses. So something that I think all people should know about, and I'm really excited to talk about today.
Yeah, let's talk about the 8. And I have to think that you mentioned it before, knowing your numbers, your cholesterol, other aspects of your, that's pretty simple to do. You go visit someone like yourself or your primary care physician, usually covered by insurance, and it's all quite doable, doctor.
Yes, definitely. Definitely want to get screened. Definitely want to get screened regularly. Definitely want to know your family history, because sometimes you want to get screened even younger than recommended, just to make sure you're not at risk. But yeah, we can definitely walk our way through that checklist of the Life's Essential 8 if you're ready.
Yeah, you shoot. You go and I follow.
Okay, wonderful. So, I'm going to order them in my preferential order. And the first one is simple. It's eat better. You know, I, even as a cardiologist, I can see how it's really tough to eat healthy. We're all so busy. We have so many things going on, but essentially we want to eat whole, unprocessed foods. So think vegetables, think fruits, think healthy fats like avocados and lean protein. Unfortunately, our society, we're culturally saturated with ultra processed foods. These are foods that have a lot of salt, a lot of sugar, a lot of unhealthy fats, and quite frankly, they're engineered in a way to make us addicted to it. So a lot of time, these ultra processed foods are way more convenient, but it's really going, you know, shopping at the grocery store, getting a lot of the vegetables and foods that will spoil if you don't cook them over a couple of days, taking the time to cook regularly, which is not something I like to do. So I had to make that my habit, but it really has huge, huge, huge implications for how you age over time. So definitely number one thing I'd say is to eat better. The second thing on our list is to have healthy sleep patterns, to get a healthy amount of sleep. So it is recommended that adults get, on average, between 7 to 9 hours of sleep per night. And I don't know about you, but when things get hectic, and for many years, that was one of the things that I could easily cut off my list, you know, getting by on 5, 6 hours. But studies show that when we get less than 7 hours of sleep, our body actually releases these stress hormones, something called cortisol. And this is something that triggers weight gain. It triggers our blood sugars to go up. It can increase our risk for high blood pressure. And honestly, it triggers things like anxiety, depression, and even dementia in the future. So it may not seem like the most important thing, but it's absolutely critical to get about 7 to 9 hours on average of sleep if you can.
Yeah, and you probably, yeah, sorry, doctor, I just was going to make the comment. Sleep hygiene, that is probably something that a lot of people, we're all surrounded by screens like this my on my iPhone, on the
Yes.
computer. It really makes it difficult to get those sleep. You got to have the right process to get yourself to relax and go to bed.
You really do, and you're right. You know, our bodies have evolved to kind of follow what sunlight does, and unfortunately, with phones, it makes it impossible sometimes to go to sleep. We're just so much information, but really trying to shut that down an hour before you go to sleep. You know, read a book, just wind yourself down. That'll make it easier for you to go to sleep because you're right. Things like screens can make insomnia a very real issue. Thanks for bringing that up, Jeff.
Okay. Yep, and continue. I'm sorry for interrupting you. Continue on
Yeah,
your
no.
preferential list.
Yeah. So number three on that list is exercise, exercise, exercise. On average, Americans need to exercise more, and this is such a powerful thing. The American Heart Association recommends at least 30 minutes of exercise about 5 days a week. And remembering that cardio is profoundly important, but muscle strengthening is really critical too. After about age 30, we start losing our muscle mass. And this is how, as people age, they can become frail, more prone to falling. And so it's really important that if we're not only doing our cardio, but we're strengthening our muscles, you know? And again, being a busy cardiologist, you know, I'm a wife, I have kids. That was something in the past that was easy to kind of put on the side. But I'll never forget having a 92-year-old patient come to see me in the office. He drove himself in and he was telling me about how he had just exercised that morning and he had done 500 rows on his rower. And I realized that, you know, envision the kind of person that you want to be when you're in your 70s, 80s, and 90s. If you're not doing those things now, it's going to be really important. It's going to be almost impossible to have that independence and ability to do those things as you get older. So I always tell people it takes time, but it's worth investing in the fitness and exercise now to help keep you independent and healthy in the future. And exercise helps to prevent things like high blood pressure, diabetes, high cholesterol, and helps maintain our weight. So very important, number three on the list. So number four on the list is something that we kind of alluded to earlier. It's keeping our blood pressures under control, okay? And this is what you were talking about, getting screened. It's recommended that our blood pressures be less than 130 on top, the top number, 80 on the bottom. Those represent the force of blood and as it's pushing through our body. And the lower it is, the better. So 120 over 80, even better. And less than that, even more. What I've found out is kind of tying into eating healthy is that I was starting to see a lot of 20-year-olds, healthy and fit, coming in with high blood pressure. And that's because we're unfortunately consuming a lot more salt than our bodies were ever meant to consume in ultra processed foods. So, the number one thing I would say about that is we should all know how much salt we're supposed to be having in a day. And in the meals that we're having, we should be looking at how much salt is in those meals. So, on average, if you don't have high blood pressure, we should be having less than 2,300 milligrams of salt. And I'll tell you, there was one time I went to a restaurant to have a meal, and it had 7,000 milligrams of salt. Salt, also referred to as sodium, in this meal that had wild rice, some broccoli, some seafood. And that goes to show you that you could be eating an astronomical amount of hidden salt if you're not kind of looking in the details. So I always look at nutritional info, or I'll look up a restaurant and see if they have their sodium facts listed. That's a real proactive way to try to help keep your blood pressures down, but to also, take blood pressure medicines if you need to, because that really helps protect your organs.
Yep.
Yeah, so that was number 4. Now, number 5 is keeping our blood sugars under control. Diabetes is something that's really prevalent. Like I mentioned, it accelerates the wear and tear and, quite honestly, the breakdown of our organs. And so we should all be getting screened for it. But very importantly, is we should know how much added sugar is our limit in a day, right? So adult women, we're not supposed to have more than 25 grams of added sugar in a day. And for men, it's about 36 grams. Now, I will tell you, there are a lot of, bottled drinks out there that can
Oh
easily
yeah.
have almost 80 grams of added sugar in drinks that are considered really normal in our society, that we could drink 1 or 2, 3 times a day. And unfortunately, that almost makes us a ticking time bomb for developing diabetes. And it makes it really hard to get it under control, even when you're taking the medicines for it. So even in my life, and along with my little kids, like, they know to always look at the nutritional info and see how much sugar is in something. It may be packaged as something really healthy, but the facts don't lie. So knowing that added sugar can really help prevent the development of diabetes and pre-diabetes.
So suffice to say, you probably don't have Fruit Loops in the house.
My kids beg for it, and they've had it when they were with friends, and like, oh my goodness, this is so good. But you know what? It really ties back to that fact about ultra processed foods. Like, these
Yeah.
foods have a lot of artificial dyes in it. They're like addicting for little kids, because you can't, like, a sweet potato is not going to compete with Fruit Loops in terms of taste and texture. But really being aware of that will spare you from becoming a diabetic, or struggling with your weight down the road. So yeah,
Yeah,
you are
absolutely.
right. We stay
Yeah.
away from the
Stay
Fruit
away
Loops.
from sugar smacks, all the ones that I grew up with not eating, because my parents never let us have any of that. Doctor, number 6, please.
Yeah, so number 6 is to know your cholesterol. That's a pretty straightforward one. Get screened for that and know if high cholesterol runs in your family. Just really get checked for that. So that's an important one. And then smoking. We all know that staying away from cigarettes is tremendously important. So that's a really important one that we should just not do. And then keeping track of our weights, and making sure that we try to keep our weight in a healthy range is the eighth one on the list. And this has become a hard one as the years have gone by. And I don't want to blame everything on ultra processed foods, but the content of sugar that's in our foods have made it such that people are gaining weight, and they don't really know why. They don't even feel like they're eating a lot of stuff. And while exercise is important, I always tell people that you can't can't out-exercise a bad diet. So really being mindful of something called the BMI, the body mass index. And that's not a perfect measurement because it doesn't take into account muscle weight and things like that. But a BMI of 30 or above qualifies as obesity. So trying to keep it less than that and ideally less than 25. And there are a lot of medications in addition to healthy diet and exercise, which are really powerful. But that is also a key thing to not overlook. You know, if everything else on that checklist is great, but the weight is higher than it should be, really making a point to see what you can do to get that in order. Not only will it be good for internal health, but even things like your joints and the quality of sleep that you have, it can really, really help with that.
Well, doctor, I mean, I think they're really common sense. And made a mention that these guidelines, these facts kind of came out in 2022. Do you think we're making a difference in terms of getting this information in the hands of adults and children? Do you think it's making a difference?
I think it's making a difference, but I do think that we have a long way to go. And as I see patients in the office every day, not only do I treat heart disease, I'm very much a strong proponent of preventing heart disease. There are a lot of these facts that patients don't know about. They don't know about how the hidden salt and the hidden sugars in a lot of the common foods that we eat, or even just how critical sleep is. And I say that because for me, myself, for many years, I've kind of just tried to see if I could cut corners, you know, but especially as we all get older, it gets harder to fight off all of the chronic illnesses that plague us. Blood pressure likes to get worse, blood sugar and cholesterol like to get worse. For women, as estrogen drops, our weight distribution gets worse. It's harder to keep off that belly fat. And so we always have to try to be doing all of those things on the checklist to keep things in order. And I always tell people this is the one body that we get, and it's really worth the time, like nothing else is, to really help keep our health and maintain our health. And what I've really found is that when one person in the family takes the baton and starts improving their health, it can truly, truly be contagious. With partners and with children, it really has the benefit of changing the trajectory of so many lives. So really an important and critical thing to focus on.
Yeah, and for me, that would be my lovely wife. Dr. Charles, we're going to have to leave it there. Great work. Thank you so much for joining us. Keep up the great work on your end, and we look forward to having you back on the program again very soon.
Thank you so much, Jeff. Definitely an honor.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website, and your subscription helps support all this great BRN content. We're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.